Okay, so we've cleared the first rib and the lateral flexors, challenged that range. I'm just going to do a little bit of work on Dan's thoracic on his right side here now. And like for before everyone loses their shit, yes, I would work both sides, but for the benefit of this video, I'm just time wise, I'm just working the right hand side. So yeah, let's not get over anxious about me not working bilaterally, God forbid. Okay. So just look, general effleurage through here, just having a bit of a feel, see what he's like. I know what's going on with his lower back, so I'm going to do some mobs through there. But before I do that, I'm just going to try and free up a little bit of this lower trap. I mentioned that beforehand. Your lower trap comes down here, you've got your lats. So usually what can happen sometimes, you can get a little bit of restriction through that lower trap. So I've always got to make sure that's working. And that is entirely important, especially if we're talking about working with shoulders as well. So how do we do this? Here's the edge of our lower trap. You can see there. So what I'm going to do is I'm going to come along. My forearm's going to butt basically right up against that lower trap. Okay. So I'm going to sort of create a wave. You can see that there's a wave there. So a little bit of pressure down, but the actual pressure is going to be going this way. So this is just a really slow, almost like a myofascial technique. Is that pressure okay, Dan? You sure? Yep, not too much pressure back into your spine. That's okay. So I'm not actually traveling that far. I'm just challenging that trap to lift. Okay, so just create that wave there and then just really broad, purposeful pressure. You can see through there. Like so. Obviously, I do it bilaterally, but at the moment I'm just doing it to the right because that's our side we've decided to target. And what you can do sometimes is bring their arm up a little bit. Yep, that's good. And then a little bit of abduction just stretches a little bit more too. Is that comfortable for you there, mate? Yep. Sure? And this is a real game changer for shoulders and thoracic function. Beautiful. Right, back down there.
What's your indicator for change in that area?
What's my indicator? Yeah. What good question. Right. Okay. So, and this is what my clients ask me, and I'm sure your clients do too. So what am I looking for? Okay, so first thing I'm looking for is how much resistance, how much pressure, and how much resistance I get. All right. So when I do it the first time, it's like, right, I've got to put a fair amount of pressure into that. I've got to wait a little bit longer. And there's a certain amount of resistance to it. Do you know what I mean? Once it starts to free up, I don't have to put as much pressure, and then there's hardly any resistance. Does that sort of, yeah? That's the easiest way I like to say it. My clients ask me that a lot. They go, oh, how do you know what you're feeling and if you're getting a change? That's my indicator. They come in for the next treatment. You're working on their infraspinatus, and they're saying, "Oh God, that's still really tight." And so I go, "Yeah, but you know what? I'm putting twice as much pressure on this now, and when I glide through it, there's no resistance." Yeah. Do you find that too?
Yeah,
Yeah.
yeah. And I get a lot of clients saying, "Oh,
Yes. Perfect. Yep. Yeah. Yeah. That's it. All right. So it's going to come down a little bit to his lumbar here because I've obviously got to do some work for this hip and lower back, and obviously I'm going to have to target his QL. But before I do that, I'm just going to do some general effleurage over here, and then I'm just going to mobilize his L1. Now, I found this technique again from another really great physio back in the day. And I know a lot of people like to think that they're treating psoas, but because psoas comes and attaches up on that T12L1, I like to come over. I'm going to get right on the transverse process of your L1. and this is going to be uncomfortable, all right, mate? And it is. If you push into people's transverse, it's always tender. So I'm just going to do the little sort of like lateral mobilization. So I'm just going to sit on this. Can you handle that pressure? Is that all right? So I'm just engaging the transverse process, pushing it sort of just laterally and a little bit PA-ish. And the whole idea here is to just slowly increase the mobs.
While you're doing it, can you feel restricted through separate joints as well if there was
Yeah, possibly. Yeah. Yeah. What do you find that, Dan?
no, just if you've got a client that's got sacroiliac joint
Yep.
restriction,
Yep.
this lateral flexion,
Yeah. Yeah.
kind of
Sorry. Yep. Yeah.
joint
Yep.
and the whole hip go with it.
Yep. No, I know what you mean now. Sorry, I was confused by your question first there, but I know what you mean now. Yep. Absolutely. Yeah. Okay. So I'm just you'll probably feel that I'm increase that mob a bit more. Is that still okay? You sure? Yep. So do this for about 2 minutes, just ever so slightly, just increasing the mobs. You'll be surprised how good this feels after it. Just such a such a highly innervated area, this thoracolumbar. And as we know, we've got those trigger points that lie right in sort of like from L2 to T10, and they refer down to our bum, top of your bum, deep buttock as well. So obviously that's a port of call for us as well to get in there, especially lumbar spine, general lumbar spine stiffness and so forth. So I'm just going to come over. Sorry, Dan. I'm just going to do a little bit more broader work, deeper, broader work. You let me know if that's comfortable. Yep. Right. Now it's backed off. So it's right over that upper part for you. There, about there. Beautiful. Yep. Great. That's what we want. So do a little bit of this. Got to make sure you get right. I mean, I know you've got to get right over your clients. Have your elbow. Don't be doing this. Get that pressure. All right. You sure that's okay? Yep. Yeah. But yeah. And you're not guarding against me, which is good. So that's what I want. Yep. Good. Just one more. That's great. Righto. Let's pop your arm up here. Sorry, buddy. All right. So now I just want to really just open this up. So now I'm just targeting these paraspinals. Just work all the way down there. So I'm just going to add a little bit of traction just on your shoulder, mate. Is that all right for your shoulder?
Can you get the client to reach up themselves, or would that?
Yeah, no, absolutely. Yeah, especially if they're switched on enough, Dan. But I'm multitasking here. There's so many males multitasking. I'm doing it. Living proof. Okay, so now obviously I need to do some work on this QL, but I'll get you side lying for that. Geez, that's a wonderful tattoo. Dan, thinking about getting that redone?
No, I'm too old now.
Okay, just going to have a feel. Just some of these lower segments here, and you didn't have any specific issues with your lower back in terms of pain, which is great. So I'm just having a feel of your lumbar ligament because that's that's a real shitty one, especially getting into extension. Feels pretty good. All right, let's stop there and